Okay, and next, I have 3 other bills that we are going to take out of order again. These 3 bills are all apply to the same subject matter. They are House Bill 5151, 5196, and 5251. If you'll just bear with me for one moment. There are quite a few people that are going to testify virtually, and they will testify on all 3 of these bills. First, I'm going to have Representative Morales. If you would introduce House Bill 5151, we'll put it in play, and then we will take testimony from all of the people, because we do have some repetitive people who would like to speak. So go ahead and put that in place, sir.
Thank you so much, Mr. Chairman. Now, Mr. Chairman and members of the committee, thank you again for the opportunity to discuss and consider House Bill 5151. In summary, this bill would limit out-of-pocket expenses for a 30-day supply of insulin at $25 for people with health insurance. For general context, insulin is a life-saving prescription medication for people with diabetes. Insulin itself is a hormone in our bodies that helps us break down sugar into our bloodstream and into our cells in order to create energy. If you have diabetes, your body either does not make enough insulin or is unable to use the natural insulin it makes, which is why prescription insulin is necessary. The result of untreated diabetes due to a lack of insulin can lead to a stroke, prolonged heart disease, blindness, and even death. All that to say, insulin is literally a life-saving medication. Across our state, over 80,000 adults have diabetes, which is more than 10% of our adult population. And sadly, the rate of Rhode Islanders diagnosed with this disease continues to increase each and every single year. Between 2011 and 2019, the rate of Rhode Island adults diagnosed with diabetes increased by 24%. Furthermore, the Rhode Island Department of Health has estimated that nearly 24,000 adults currently have diabetes without even knowing it. It is clear, diabetes is a serious public health issue in our state, which is why it is necessary that our state government ensures prescription insulin is affordable for everyone who depends on it. The people we represent should not have to worry about whether or not they can afford to survive. Similar to many other life-saving medications, the out-of-pocket expenses for insulin is extremely expensive, especially for working people and middle-class families. In 2012, the average cost of insulin was $236 a month, or equivalent to $2,864 a year. In 2016, it rose to $475 a month, or $5,705 a year. In some cases today, a single vial of insulin, which is only a week's worth of supply for some people, can be up to $300. As a result, we have thousands of people in our state who are forced to ration their insulin because they cannot afford their daily doses. Just last year, we had a Providence resident who felt the need to start an online petition demanding that our state leaders address these outrageous costs. During the same time period, Dr. Luke Mezek, a resident physician who specializes in emergency medicine, wrote an op-ed in the Providence Journal to discuss a case where he treated a young woman who was diagnosed with ketoacidosis, a fatal complication of diabetes which could have been avoided had she been able to afford insulin prior to this diagnosis. These hurtful stories explain why 21% of Rhode Island residents reported that they stopped taking their prescribed medication due to cost. And this is based on a 2017 report conducted by the AARP. And these hurtful stories, alongside the economic impact which COVID-19 has had on all of our communities from a financial basis, is why myself and over a dozen co-sponsors introduced this bill. It is also why the Rhode Island Nurses Association, the Rhode Island American College of Physicians, and the Rhode Island Healthcare Access and Affordability Partnership have come out in support of this bill. From Newport to Johnston to Pawtucket, We have neighbors who are forced to go into medical debt just to pay for life-saving medication they need to survive. Now, I understand there is opposition to this bill from the health insurance industry, and I am positive that they will tell us that they agree with the sentiment that medicine should be affordable. However, it is not financially possible for them to do so. Following this, they will spread misinformation claiming that they will be forced to increase rates on everyone, when in fact they have the ability to negotiate the price of prescription drugs directly with pharmaceutical companies. And that is a privilege us consumers do not have. After all, a vial of insulin only costs an average of $3 to manufacture, yet it is being sold for over $200. Furthermore, the state of New Mexico currently has a $25 limit for a 30-day supply of insulin, and as it stands, insurance rates have not increased as a result of this. The same can also be said about the 7 other states that have monthly out-of-pocket price caps on insulin, such as Utah, West Virginia, and Colorado. In other words, when the government takes action to address these outrageous costs, it leads to healthier patients who are able to take their medication, thus reducing the costly visits to the doctor's office and the emergency rooms, which the insurance companies would thereafter have to cover. In addition, these limits on out-of-pocket expenses incentivize the health insurance companies to negotiate with drug makers and demand a lower cost, which they are currently not doing. Now, before I close, I do want to note that I will be requesting a sub-A amendment to add language to this bill that would ensure that coverage for insulin is not subject to any deductible. Overall, this bill will make sure that our community members with diabetes are able to afford their prescription insulin. For too long, working people have been forced to choose between filling their prescription or paying for basic needs like groceries. We have a crucial opportunity to address the expensive cost of insulin, and I truly hope that together we can make this possible.
Thank you, Representative Morales. Are there any questions from the committee at this time for Representative Morales? What I'd like to do, like I said, is put all these 3 bills in play. They do cover the same subject matter. And if there's no questions for Representative Morales, I will introduce the next bill. Oh, no, we have Rep. Diaz. Rep. Diaz is online with us, so we will do that. Are there any questions for Representative Morales? Hearing none.
Mr. Chairman, I did want to mention that Representative Michelle McGaugh, who is also a co-sponsor on this bill, is here.
Is here, okay. Is she on the list? We'll take care of Representative. Yes, we'll do that.
Thank you.
Let's get all 3 bills in play first. Representative Diaz. Can we unmute Representative Diaz?
Yes, thank you so much.
Representative Diaz, you have the floor for House Bill 5251, which is similar to Representative Morales' bill. If you will go ahead and introduce it to us. Thank you.
Thank you so much, Chairman and members of the Health and Human Services. I love the energy that Rep. Morales brought to the floor. And I love it because I'm in the House for 17 years, trying to bring awareness of diabetes, which is the cause of death for many Rhode Islanders, especially high numbers within the Black and Latino community and people of color in general. The bill in front of you is totally similar to the one Rep. Morales introduced, and it's a bill that I introduced for 3 years now, because you have too many bills addressing the issue, which is so relevant and important for every single Rhode Islander who's facing diabetes. I'm willing to work with him and others who introduced the same bill to find the best way to benefit Rhode Island in order to get insulin when they need it. I believe that diabetes is something that many of the members of the House we are facing, and it's something that also we're facing in our families in personal level. I agree that the cost of insulin cannot be something that the family has to decide between eating or having insulin. So with us, Mr. Chairman, I'm willing to work to be sure that this committee passed legislation to helping Rhode Islanders to have access to insulin. So thank you for the opportunity.
Thank you, Representative Diaz. If there are there any questions from the committee for Representative Diaz at this time? If not, I will introduce Representative Brian Patrick Kennedy, Speaker Pro Tem. He has House Bill 5196, and that is also on the same subject matter. Representative Kennedy, when you're ready.
Thank you so much, Mr. Chairman and ladies and gentlemen of the committee. So my bill is House Bill number 5196. I have been introducing this particular legislation now for several years. First one was back in 2019, towards the end of the session. Unfortunately, it was past the deadline for committees to take action, so we could not do anything. The bill had a hearing last year in the HEW committee, and I thought we made a little bit of progress, and then we had a pandemic. So I'm back here introducing the bill again this year. There is one major difference between my legislation and the other individuals who sponsored their legislation. My legislation is different in the fact that, number one, it would create a copay not to exceed $50 for a 30-day supply, regardless of the amount or type of insulin that's needed for the prescription. The coverage would not be subject to any deductibles. This is very important. This last section is important since quite often patients have to pay the list price for the insulin until they meet their out-of-pocket deductible. And the list price is quite often much more expensive than the negotiated price that you get once you've met your deductible. So with that, specifically during this pandemic, when people are trying to figure out how they're going to cover their expenses, being able to ensure that when they buy their prescription insulin, that it also meets part of their deductible is going to be very, very important going forward. We've seen in the past couple of years with the steady increase in the price of insulin, what most people don't even realize is that when it was discovered a little over 100 years ago, it was regarded as one of the most important medical discoveries of the 20th century. And the patent for insulin was sold for $1. $1. And yet, now we have seen this situation occur where the cost of insulin has just gone through the roof, and there's no reason for it. Earlier in the 1990s, the typical cost for insulin was about $25. Now we've heard $300, $400, even $500 for that very same prescription. It's causing rationing, resulting in complications, as was previously pointed out. As of today, 15 states have passed insulin copay or cap legislation. And last fall, the Trump administration announced that Medicare insulin copays would also be capped for 2021, the year 2021. So those who are on Medicare are already receiving the benefit of this particular ability to have a price cap. As I mentioned, since I've been introducing this bill for so many years, have been working very closely with the American Diabetes Association. We have a letter which you probably have in your packet or will be receiving it from Stephen Habe in support of this legislation. We worked on the language throughout the year 2020, and in 2021 came up with this particular version of the act. So again, I think this is an important bill. I think this is the year that we should try to take action on it. And most importantly, I think it's important to address that issue of keeping it, when you make your payment for your monthly allotment of insulin that you need, your 30-day supply, that it also meets the deductible requirements. Any questions?
Thank you, Speaker Pro Tem Kennedy. We do have a few questions from the committee. If everyone will just be patient, I'm going to entertain Representative Ackerman first, and then we will move along to the rest of the group.
Thank you, Chairman. The representatives, I'm just looking right now, the representatives are not exaggerating. I'm actually on the GoodRx app right now, which usually you find your prices next to nothing on this app. And I'm looking at insulin, and it's every single kind from every single place is over $200, and this is on GoodRx. So you can imagine what the regular price is for the consumer who doesn't use an app like this. And it is a growing concern. I know of so many people who just found out in the last year that they have diabetes. You could be walking around and not even know you've got it. And then once you're hit with the cost, forget it. So I think you're right. This is the time that we need to address. This is the year we need to address this.
Well, as I mentioned,
Thank you.
we always see the advertisements on TV for GoodRx and how much money it can save an individual. As I mentioned, when the patent was sold for $1, the whole belief was that insulin should belong to the world, and that's why it's there to save the lives of those with diabetes. But for whatever reason, we've now gotten to the point where a simple patent that was sold for $1 is now fetching huge sums of money for a 30-day supply on the open market, and there's no reason for it.
Thank you, Speaker Pro Tem. We have Representative Morgan next.
I got it. Okay. Thank you for putting this in, Representative Kennedy. Medicare was going to offer it for $45, but my understanding is President Biden has suspended that because the pharmaceutical companies are really pushing back hard. Have you had any communications with?
I have not. So, in fact, before the hearing, the chairman and I were talking about that, wondering if the Biden administration was going to take action. So that's the first I had heard.
Yeah, so we suspended it. Now, you said 15 states are doing this.
15 states. In fact, Connecticut, New York, Vermont, and New Hampshire have all passed legislation just in our region.
And their experience, what are the pharmaceutical
Connecticut,
companies doing for them? Or
well, Connecticut passed it last session, towards the end of their session, so I don't know if it's fully been implemented in the state of Connecticut as of right now. I haven't heard of any of the other states where there has been an issue.
Having problems with getting it or?
No.
Okay, great. It's a good idea. It's a good idea.
Thank you, Speaker Pro Tem. We have Representative Fogarty with a question.
Well, actually, I thank all three of you for putting in these bills on insulin. I know my brother takes insulin. He doesn't look like a diabetic at all. Very, very thin and skinny. But it is really very, very costly for him. And for just tweaking the molecule for long-acting insulin or short-acting insulin, I always thought is really, it's terrible that people are treated. And I was just wondering the ADA and their support on this with the other states that you mentioned, if they talk about really the ounce of prevention versus pound of cure, 80% of the patients with diabetes die of cardiovascular disease. That's the stat overall with diabetes. And I would think that they would spend the money on insulin for these patients and really try to keep the blood sugars in control, because in the long run, you're going to end up with a cardiovascular type of an event, which is going to cost the insurance companies more money, having a patient in the hospital, putting a stent in, having some type of open heart surgery, or them just passing away, period, with leaving a big medical bill for the families. So I don't know if anybody out of the three who put the bills in, and I know Rep. Diaz has worked with the ADA and had a lot of, over the years, I know I've attended her World Diabetes Day at the State House. What was it, ADA who helped push some of the insurance companies or in these other states to fold and maybe come with these types of caps for payment for insulin? Has anybody reached out, or does ADA have any direction for that? I'd like to see something, hear some information on the background.
Well, Representative Fogarty, I can tell you that Stephen Habe from the American Diabetes Association will be calling in very soon.
Okay. Good. I'd like to see it happen. It's much too expensive for a drug that's been around for a long, long time. It should be generic and cheap.
Thank you, Representative Fogarty. We have Representative Speakman now.
Thank you, Chairman. My question is, so all three bills limit the amount of money that insurance companies can collect for insulin. But it seems from what Representative Morales said that the problem is with the manufacturers. So can you help me understand how that loop works in driving the cost down? Do the insurance companies then put pressure on the manufacturers? Can someone help me understand how that works?
Stand by. Representative Morales is going to approach the podium.
Thank you.
Thank you so much for asking that question, Representative Speakman. Yes, essentially the way it would work is, as of right now, the manufacturers are jacking up the prices of insulin despite the fact that it only costs us $3 to produce one vial. They will sell it out to the insurance companies for about $200, who will then sell it out to the consumer for about $300. And when you start putting some of these copay caps, which other states have done, it forces the insurance companies to go back to the manufacturers and tell them, now we cannot profit at the same level in which we were before. Therefore, we need you, the drug manufacturers, to charge us less of a price for the same drug. As a result, both of their profits decrease, and that only happens when the government steps in to ensure that a life-saving medication like insulin is affordable to the people who depend on it.
So just to follow up, so there's no way that the government can pressure the pharmaceutical companies directly. It has to be, the most successful approach is through the insurance industry. Is that right?
Correct. That's why I said that it is the insurance companies who have the privilege to negotiate upfront discount prices with the manufacturers as opposed to the consumers or the government itself.
Thank you very much.
May I just add too, I'm sorry, just to add in that, you also have to factor in the cost of the middleman, which is your pharmacies and their upcharge, and then also the distribution companies like something like Cardinal Health or McKesson that also does their charge in the middle of all of that too. So these are other factors that add up to the cost of your drugs too. So that should be addressed, because you get a couple more middlemen in the middle getting their dollars out of the consumers. It's the American consumers who are really paying the price for this. If you go over the borders, it's much cheaper. It's not right.
Thank you, Representative Fogarty. Thank you, Representative Morales. Representative Villa, you have a question?
Yes. Yes, this is a very important bill. So I think at this time, I just wanted to find like the three sponsors of these three bills. Probably, it's about time to pass this bill in the middle of the pandemic right now. Like, a lot of medical conditions of our constituents are going through, and most especially within our minority community. So and I think this is the time that the three sponsors of this bill probably, because the intent of these bills were, I think there's only two differences, like 25, 50, and a candidate within the cap of that were his bill. So I think three of you people probably go back and probably take a look at it and probably bring one, total bill, and we just go through this whole process. But I think this is a great bill. I think it's about time we pass this.
Thank you, Representative. I definitely agree, and I do want to emphasize the fact on why my bill in particular is capped at 25 as opposed to 50 or 100, which other states have done. And that is because the state of New Mexico currently has the most affordable rates when it comes to out-of-pocket expenses for insulin at $25 a month. And when you look at the socioeconomic status of residents in New Mexico, they're somewhat particularly similar to those here in Rhode Island, and that also accounts for racial demographics as well. So I thought they made for a perfect case study as to why a $25 cap here in Rhode Island would work. Alongside that, our neighbors up north in Maine currently have a $35 cap as well.
Thank you, Representative Morales. Okay, we are going to move to, I'm sorry. Representative Potter, I didn't see you there, sorry.
That's okay. Thank you, Mr. Chairman. I just want to say, Speaker Pro Tem Kennedy, Chairwoman Diaz, and Rep. Morales, bravo, and thank you so much for bringing such an important issue to the forefront. It's such a great sign of the things to come, to see so much overlap and so many co-sponsors on such an important issue, that it gives me a lot of optimism for what we can accomplish in this committee as we respond to COVID-19 especially. One thing I want to offer is, it seems like we have a general consensus that some work has to be done to cap a price on insulin co-payments. And when we debate between a $50 cap and a $25 cap, I think it's wise for us to all consider a lot of the people who are on insulin, who are diabetic, who are on fixed incomes. And we might not think that that amount of difference is dramatic, but $25 really can be life-changing money for people. And we should keep that in mind as we work through this bill and decide which one we want to move out of committee, hopefully. Secondly, I'd like to just remind everyone that when we hear this story of initially $1 to produce and now $3 to produce, and how it's sold and how it's moved up the ladder and where that cost is passed on to the consumer, it's a reflection of our overall healthcare system. One where we prioritize corporate profits instead of the health of people who are suffering. And it's really past time that we start looking at sick people as something other than a business opportunity. So I just want to convey that all to us as we work through the important issues that I'm sure we're going to hear in this committee throughout our response to COVID-19. It's all the more important that we put that at the forefront of how we prioritize legislation. So again, to all the co-sponsors, thank you so much. This is great legislation, and I'm proud to support it.
Thank you, Representative Potter. Okay, just to inform the committee, we have 16 people who are going to testify on these three bills virtually. I'm going to try to keep their testimony to a limited amount of time. We do have quite a long agenda today. So what I would like, Chris, if you can call our first witness. This is going to be Nicholas Doherty. Nicholas signed up in favor of all three bills that have been proposed. If we can get him on the line. Do we have, okay. Okay, so we have another representative here who would like to testify in person. Please take the stand. Introduce yourself to our committee.
Hi, Representative McGaugh, representing District 71, Portsmouth, Tiverton, and Little Compton. And I want to thank the chairman and thank the committee for hearing this bill. I came here in support of H5151, but really I'm in support of all of these bills. And I think the fact that we have three representatives all trying to address this issue means that this is something that we are hearing across the state from all of our communities, that this is an issue that really does need to be addressed. So, you know, I don't want to reiterate what's already been said about insulin being a life-saving medication. Representative Morales made an important point that 80,000 people in Rhode Island, it's estimated, are being treated for diabetes. That's an extensive component to our population. According to the American Diabetes Association, people with diabetes diagnosis have an average medical expense of $16,752 per year. Think about what that means to people in our state living on a fixed income. According to that same ADA research, the cost of care has increased by 26% over a 5-year period. The cost of insulin has tripled since 2002 and has increased 64% just since 2014, with the average cost of the insulin vial being more than $300. The costs associated with the medical care and the prescription drugs is further compounded by loss of productivity, increased absenteeism, and in some cases an inability to work. The costs to diabetes are extensive. We don't need studies to demonstrate to us that the more people have to pay for their prescriptions, the more likely they are to take their medication incorrectly or to skip it altogether. But the data's there. In a 2018 report, it showed that 45% of diabetic patients skipped care because they couldn't afford it. In a 2020 medication access report, a survey of 1,000 patients showed that 29% of patients abandoned their prescriptions, not just diabetic medications, but prescriptions in general, because they couldn't afford them. Prescription copays and deductibles are killing us. The cost of insulin therapy are rising, and it's important to consider the patients receiving their insulin therapy require more than one type of insulin. We've talked a little bit about whether it should be $25 or $50. Diabetic patients don't always just require one type of insulin. They may require more than one. So when we're considering whether $25 or $50 is an appropriate copay, I want you to think about that. On average, diabetic patients require about 6 different prescription medications a month. Think about that when we're thinking about what we want to put a cap on a copay for. As the prescription drugs and the cost of insulin rise uncontrollably, patients are being asked to cost share at an alarming rate. They're being asked to carry the burden of increasing costs of life-saving medications through higher premiums, higher deductibles, and higher copays. Patients with Medicare Part D prescription drug plans find themselves rapidly reaching that donut hole to their coverage and having to pick up 100% of the cost despite being insured. As this cost sharing rises, more patients are skipping or delaying care they need, which further exacerbates the long-term complications of diabetes. So we know it's expensive, and we know when it's expensive, people will skip their care. But what does that mean to patients? Short term, it means we have more patients in the emergency room or being admitted to the hospital with issues like diabetic ketoacidosis, which was mentioned earlier. As a pharmacist, I've also seen the long-term complications of that. I've seen people suffering from the cardiovascular effects of diabetes. I've seen people go blind because of diabetic retinopathy. They also have an increased risk of cataracts and glaucoma. I've seen that happen to patients. I've seen patients suffer with kidney disease, ultimately ending up on dialysis because they weren't able to appropriately manage their diabetes. I've seen people have nerve damage and they have poor circulation to their extremities, which can cause wounds on their lower extremities, sometimes leading to amputation. These are some of the severe things that can happen when people skip their insulin doses, take less because they want a vial to last a little bit longer, or just don't buy it all together because it's too expensive. What we need to consider right now is the impact of the health and wellness of our fellow Rhode Islanders. The cost of insulin therapy is significant, but the cost of skipping treatment due to lack of affordability is much greater. These costs associated with high deductibles, unlimited copays to the life-saving treatments such as insulin are too great to be ignored. I urge you to pass one of these bills, and I'm hoping that we can work together to create one bill that includes the deductible component and that we find an agreeable copay for all of these patients. Thank you.
Thank you. Are there any questions for Representative McGaugh? Okay. As I stated, all of those who are tuning in and will be testifying virtually, we have 16 people listed on our list to testify. All of those people are in favor of this legislation. We have many bills to take care of this evening. I would ask that everybody who has heard testimony that matches what they're going to say, I would like to have us not be repetitive. I would like us also to keep our comments to a minimum so that we can continue our hearing and just have everybody heard. I believe we have Nicholas Doherty on the line. Hello, Nicholas.
Hi, this is Tate.
Nicholas, this is Representative Casey, Chairman of the Health and Human Services Committee here at the State House. We have a portion of our group tuning in virtually, and we also have people live here with us at the State House. You are testifying on 3 bills, House Bill 5251, House Bill 5151, and House Bill 5196, They're all related to the prescription cost for insulin and diabetes-related drugs. If you could keep your comments brief. There are 16 others who are going to testify. All callers are in favor of this legislation. So you have the floor at this time. Thank you.
Thank you, Mr. Chairman. Good evening, members of the committee. I do appreciate the opportunity to speak with you all by phone. For the record, my name is Nick Doherty. I'm the Director of Policy at Pharma for the New England region, and I'm based out of Boston. The Pharmaceutical Research and Manufacturers of America represent the country's leading innovative biopharmaceutical research companies, which are devoted to discovering and developing medicines that enable patients to live longer, healthier, and more productive lives. 2,000 pharma member companies have invested nearly $1 trillion in the search for new treatments and cures, including an estimated $83 billion in 2019 alone. I'm seeking you tonight to testify in support of all three bills that the chairman had mentioned. In terms of brevity, the statement we submitted to the committee provides much greater details, and I'll adjust just some general ideas here. Pharma supports this suite of legislation because these bills would immediately help patients at the pharmacy counter by capping out-of-pocket costs for insulin. There's been a lot of discussion about how old insulin is, and it's true. And we're in a new era of medicine where breakthrough science is transforming patient care. But these innovations are absolutely meaningless if patients can't afford them. Out-of-pocket costs for the sickest continue to soar despite a dramatic slowdown in medicine prices and spending. In 2019 alone, rebates, discounts, and other price concessions totaled $175 billion, and more than 9 in 10 prescriptions filled in the United States are for generics. But it often doesn't feel that way for patients, and this dynamic contributes to the fact that patients continue to struggle to afford the medicines they need. A 2019 analysis of medical spending and affordability found that 9% of all new prescriptions were abandoned at retail pharmacies due to patients being unable to afford their cost-sharing responsibility. That same analysis showed the rate of new prescriptions abandoned at the pharmacy going up to 45% when the cost was over $125 and 60% when the cost was over $500. Now, there's been a lot of discussion tonight about the supply chain, and just want to highlight the fact that all of the actors involved, there's the pharmaceutical industry, and then there's the insurers, the pharmacy benefit managers, wholesalers, and government agencies like Medicaid. So we believe to level the playing field for patients faced with high out-of-pocket costs and a need for continued access to critical prescription drugs, patients need concrete reforms that will help lower the price they pay for medicines at the pharmacy counter, such as making monthly costs more predictable, making cost-sharing assistance count, and sharing negotiated savings on medicines with patients. We believe this bill is an important step in the right direction, and for these reasons, Pharma respectfully urges legislators to support all three bills. I'd be happy to take any questions.
Thank you, Nicholas. Are there any questions from the committee for Mr. Doherty? Okay, Nicholas, I know you're testifying on another bill tonight. We're going to have to call you back on that one. We appreciate you spending our time with us, and we're going to move on to our next person to speak with, okay? Thank you, sir. Next, the committee will hear from Anna Snyder. Ms. Snyder, are you with us?
Hello, I am.
Hello, this is Representative Casey from the Health and Human Services Committee. We are testifying on three bills. You are signed up for House Bill 5151, which is related to the prescription drugs relating to diabetes. I would like you to keep your comments as brief as possible. We do have another 15 people to get to, and we'd like to move on. Everybody who is calling in and on virtual is in favor of this legislation, so if you could keep your comments brief, I would appreciate that.
Sure. So my name is Anna Snyder. I'm here to speak in support of House Bill 6151. I'm testifying as a citizen of Providence and also the daughter of a diabetic. I feel that it is morally reprehensible as well as economically insensible to allow drug manufacturers' profits to come between people of Rhode Island and medication they need to survive. People have been talking about the cost of insulin rising and how much it actually costs to produce insulin, and so I'll cut that out of my testimony. I just wanted to say that my family is fairly privileged, and so we've never lacked for health care, but I only have to spend a few seconds imagining how it would feel to have a loved one forced to choose between life-saving medication and things like food, rent, or utilities, to know that the status quo is untenable and immoral. I think it's unconscionable to allow a single person to struggle and, God forbid, die for want of insulin. I think it's outrageous that drug manufacturers are allowed to make ever-increasing profit off the need for an essential medication. 5151 will cap insulin costs monthly at $25, which would be an immense relief to those forced to exist under constant stress of knowing that they might be one emergency or a job loss during this pandemic from being able to afford a medication that keeps themselves or their children alive. 5151 will also make Rhode Island one of a national leader in insulin affordability, which is a distinction I think we can truly be proud of. For these reasons, I urge the committee to back this bill. I think it's the only moral choice. Thank you for your time, and thank you for having these bills up. It's very important, and it's very satisfying to see. Thank you.
Okay, Anna, thank you very much for keeping it brief, and that was a very nice presentation. Does anybody have any questions from the committee? Okay, thank you, Anna. We're going to move on to our next witness. Dr. Chang. Okay, Dr. Kenneth Chang?
Yes.
Doctor, are you with us?
Yes, I am. Yes.
Hello, this is Representative Casey, Chairman of the Health and Human Services Committee. I have you testifying on House Bill 5196 by Representative Kennedy regarding the prescription limiting prices on insulin. If you would, please keep your comments brief. We do have another 14 people testifying, all in favor of this legislation.
Sure. Mr. Chairman, thank you so much for this invitation, and also thank you to all the members of the House Committee. My name is Dr. Kenneth Chang. I'm an Associate Professor of Medicine at the Medical School of Brown University. I'm the Director of Endocrinology, Diabetes and Metabolism of Care New England Health System, and I'm also the co-chair of the Health Policy and Advocacy Committee of the American College of Physicians in the Rhode Island Chapter. And I also do a lot of advocacy work for the American Diabetes Association. So in short, I look after a lot of patients with diabetes in my clinical practice each day. And sadly, you know, as much as I would like to think that I would spend most of my time with the appointments going through the actual medical management, a lot of my time is actually spent in helping patients navigate and deal with the rising cost of all of the medications. Particularly over this past year of the COVID pandemic, I've heard that more and more people are struggling to make ends meet, and let alone be able to afford all of the medications. And to this end, I now hire a full-time staff member to help all my patients navigate these channels by helping them apply for financial assistance. And whilst this has been a big help, there's still a lot of people out there who are not quite able to afford their insulin and medications. And to this point, a lot of them, unfortunately, have developed a lot of complications and end up in hospital. I actually testified in this regard about a year ago, and the patient that I brought along to the hearing unfortunately is in hospital again because exactly of this same problem where, you know, she has been rationing her insulin and she wasn't able to, keep her blood sugars under control, and hence has ended up in hospital again. So thank you very much for this opportunity for me to testify, and I would urge, I strongly support all three of the bills that have been presented, and I would, we should just once again thank you to the whole House Committee for hearing all our testimonies, and please strongly consider helping all of our patients and the families out there to help their diabetes. Thank you all very much.
Thank you, Dr. Chen. Are there any questions for Dr. Chen? Thank you, Dr. Chen. We appreciate your testimony. We're going to move on to Stephen Habby. Hello, Stephen.
Yes.
Stephen, this is Representative Casey, Chairman of the Health and Human Services Committee. We have you testifying here today on House Bill 5196. We do have two other similar bills that we are hearing at the same time, all related to prescription costs for insulin. We have 16 people who are testifying virtually, all in favor. Three of those have gone before you. If you would keep your comments brief, you have the floor.
Sure. Thank you, Chairman Casey, members of the committee. Thank you for the opportunity to testify. I'm testifying to convey the American Diabetes Association support for House 5196. I've been listening to the speakers, and people have conveyed the importance of people having access to insulin to avoid complications. We do hear through surveys that 1 in 4 people are rationing insulin, meaning they're skipping doses or taking less than the insulin they need to manage their diabetes. That threatens their health, that threatens their life. H5196 would cap insulin co-payments for state-regulated commercial health insurance plans at $50 per 30-day prescription, and importantly would apply that cap before someone has met their deductible. I know this has been mentioned, but otherwise somebody would need to pay full list price until they meet their deductible, and that can be very expensive. I know 2 other insulin cap bills are also before the committee, and I'd like to thank the support from all of the bill sponsors and co-sponsors for their interest in helping people with diabetes. House 5151, offered by Rep. Morales, would establish an even lower copay of $25, and while we're supporting House 5196 filed by Rep. Kennedy due to the cap that applies, the cap applying before someone's met their deductible, the association would also support that even lower copay to provide additional cost relief. So again, I thank everyone for their interest in this issue and for their concern for people with diabetes and helping them to appropriately manage their diabetes. And if there's any questions, I'd be happy to try to help.
Thank you, Stephen. We appreciate your testimony. Are there any questions from the committee for Stephen? Okay, hearing none, we will move on to our next witness. Thank you, Stephen, very much. Mr. Hendrickson.
Hello.
Yes, Tom Hendrickson. This is Representative Stephen Casey, Chairman of the Health and Human Services Committee. I have you on virtual to testify on House Bill 5151 relating to the cost for diabetes medication and insulin. We do have many people testifying virtually in favor of this bill. If you would keep your comments as brief as possible, we would appreciate it. Go right ahead.
Yes, thank you. Thank you. My name is Tom Hendrickson. I'm currently a student at Providence College and the Vice President of the Providence College Democratic Socialists. I'm speaking tonight in support of House Bill 5151. I wanted to share the experiences of one of our organization's members. She wasn't able to participate tonight, but she asked me to pass this along. She works as an EMT, and she explained that she frequently responds to diabetic emergencies that are the direct result of people being unable to purchase insulin because it's too expensive. She encounters situations all the time in which people are forced to choose between buying insulin and eating, buying insulin or paying rent to keep roof over their head, and buying insulin or buying clothes or school supplies for their children, or other basic necessities. Nobody should be forced to make these sorts of choices, yet nearly half of diabetics report skipping taking their insulin because of rising costs, according to a 2018 survey. House Bill 5151 will limit out-of-pocket insulin expenses to $25 per month. Passing this bill will ensure the diabetic Rhode Islanders will not have to choose between paying for their insulin and having the basic necessities for a dignified human life. In short, this bill will save lives. So on behalf of myself, my organization, my EMT friends, and all of the diabetic Rhode Islanders struggling to afford insulin, I implore the committee and the Rhode Island State House of Representatives to pass House Bill 5151. Thank you.
Thank you, Mr. Hendrickson. We appreciate your testimony. Chris, who do we have next? Hello, Mr. Gregerson.
Hello.
Yes, this is Representative Casey, Chairman of the Health and Human Services Committee. We have you here to testify today on House Bill 5151 regarding limits to insulin costs. If you would please keep your testimony brief, we would be happy to hear your testimony. Thank you.
Thank you for hearing my testimony. Rhode Island has a problem. Insulin costs are straining Rhode Island family budgets and forcing Rhode Islanders to choose between good health care and other vital needs. Why? According to a U.S. Senate Finance Committee report released last month, it's because the three major drug manufacturers that sell insulin in the U.S. aggressively raised the wholesale acquisition cost of their insulin products. The price increases were often the result of shadow pricing, where one company tracks whether its competitors are raising prices and then raises its own price. Shortly after. The companies increase their prices in lockstep, often announcing price hikes within hours or days of one another. The companies are also refusing to provide discounts to hospitals serving communities in need, which the U.S. Department of Health and Human Services criticized as unlawful. The companies filed lawsuits against HHS to squash the criticism, while 6 national hospital and pharmacist organizations countersued to make the government enforce the law. The shady business practices of the drug manufacturers is bad news for Rhode Islanders who need insulin to stay healthy and alive. And even worse is how they'll continue to be hurt for years, while any action that might stop or reverse drug company price gouging is tied up in court. Luckily, our Rhode Island state legislature has the ability to bypass the court battle and help our Rhode Island families and friends by passing this legislation with its simple and straightforward fix. I'd also like to add some context to thoughts about our health insurance industry neighbors and the burden that this bill would put on them. A headline from an August 2020 article from Fox 5 News in New York reads, U.S. health insurers post huge profits during pandemic. And the report goes on to note that income for Aetna, the insurance arm of CVS Health, jumped 55% to $2.9 billion in the second quarter of 2020, and that Anthem Blue Cross Blue Shield's profits doubled to nearly $2.3 billion at the same time. If we talk about a true definition of burden, we need to consider who is really weighed down by these costs. In the current economic downturn, health insurance companies are doing fine, really fine, while Rhode Island families aren't doing nearly as well. It's clear that this legislation won't make CVS and Blue Cross suffer. They can afford it. And if they want to be good neighbors, they'll recognize that and do their part. Thank you so much.
Thank you for your testimony. Are there any questions from the committee at this time? Okay, hearing none, we'll move on to our next witness. Okay, thank you.
Hello?
Hello, Jackie Goldman, please.
Yes, this is she.
Jackie, this is Representative Casey, Chairman of the Health and Human Services Committee. I have you online virtually testifying on House Bill 5151. You have the committee's attention, and if you would keep your testimony brief, we would appreciate it. Thank you.
Great. While I'm on, can I also talk about H5245, which I believe is also being heard here, which is the harm reduction bill?
At this point, I can't entertain that. We're hearing these are...
Got it. Okay. Yes. I will just speak about insulin then.
Thank you.
So my name is Jacqueline Goldman, and I am an epidemiologist at Brown University School of Public Health, and also just a resident of Providence. I want to echo everyone else in that they've been saying that insulin prices are an absolute travesty and unconscionable. The fact is that it costs about $5 to manufacture a vial of insulin, and yet people are still having to choose between buying insulin and getting their other healthcare costs met. I think that H5151 would be a really important bill to pass. And as others have stated, that $25 cap doesn't seem that big of a difference between 5-1 and the others, but that extra $25 for a week to 2 week supply is massively important. So I don't want to take too much of your time, and that's all that I want to say. But I could not be in stronger support of this bill, and thank all of you for the hard work that you do.
Thank you, Ms. Goldman. We appreciate your brief testimony, and I appreciate also your passion. Is there any questions from the committee? If not, we will move on to our next witness. Who do we have? Julius Ferraro.
Hi.
Hi, Julius.
Thank you for having me.
This is Representative Casey.
I can hear you.
Okay. You are on with the Health and Human Services Committee regarding House Bill 5151. If you would keep your commentary brief, we would appreciate it. Go right ahead.
Great. My name is Julius Ferraro. I'm calling to testify as a citizen of Providence, Rhode Island, in support of House Bill 5151. I will be brief. Insulin is expensive, so expensive that people die without getting access to this medication, and others make tremendous sacrifices. And while insulin prices continue to rise for the consumer, there's been no change in the process for creating the product. Eli Lilly's insulin injections cost American consumers $275 for a 30-day supply. These same injections cost $32 in Canada, and they cost Eli Lilly less than $10 to make. Those are drug dealer margins. Drug companies have been gouging patients for far too long. We need to make sure that everyone can afford their insulin. That is why a $25 cap is so important. By limiting copays, we can make sure that people can access these vital drugs. I ask the committee to vote in favor of this bill and to vote in favor of the people of Rhode Island. Thank you.
Thank you, Julius. We appreciate your testimony. Are there any questions from the committee? Are there any questions from the committee? Hearing none, we'll move on to our next witness. Hello, Mr. Lee. Isaiah? Hello, Mr. Lee? I don't know if he's hearing me. Okay, next we have Terry Martesian. Mr. Martesian? Mr. Martesian?
Martesian?
Who am I speaking to?
Isaiah Lee. Isaiah Tobias Lee.
Okay, Mr. Lee, this is Representative Casey from the Health and Human Services Committee. I have you online with the committee right now regarding House Bill 5151. If you would like to testify, if you could please keep your comments brief.
Yep.
Thank you.
I'd like to begin by thanking the committee and the chairperson for hearing my testimony today. This is how democracy continues to function. My name is Isaiah Tobias Lee, and I am in support of House Bill 5151. While I do not need insulin, I believe pretty much everyone has experienced financial turmoil due to the control insurance companies hold over our lives. And this bill isn't exactly the end of predatory insurance companies, but in a global pandemic, I think it is important that Representative David Morales has decided we should start taking a stand against corporate violence. He is showing that he is committed to the working class people who got him elected. Your constituents, the people who need you to support them, are struggling to make rent already due to a lack of stimulus and job market crash.
Excuse me, Mr. Lee. Mr. Lee,
yes.
I appreciate your passion. If you could keep your comments to the contents of the bill, I would really appreciate that. We have a lot of other people to testify. Thank you.
I'm confused. I was talking about the bill.
Okay. I would like to hear about your opinion regarding the cost of insulin.
Yes.
Go right ahead.
Those of us lucky enough to have health care should not else to go bankrupt for life-saving medicine. It's that simple, and unfortunately, despite the fact that the vast majority of people agree on the matter, I am fearful that some of you are in the pockets of lobbyists.
Okay.
Make no mistake.
Mr. Lee,
Yes?
do I have your attention?
Yes?
Okay. This bill is pertaining to the cost of prescription insulin. I am not looking for commentary regarding your opinion on the current political state. You understand what I'm saying?
I wasn't talking about that.
Okay. Please refrain from commentary that is not related to the bill. Continue.
I'm in support of the bill. Thank you for letting me speak. Goodbye.
Are there any questions from the committee for Mr. Lee? Thank you very much, Mr. Lee, for your testimony. Can we have our next witness, please?
Mr. Martinez?
Mr. Martesian.
Yes.
Hello, sir. This is Representative Casey, Chairman of the Health and Human Services Committee. We're pleased to have you testify on House Bill 5151, 5251, and 5196. This is all regarding insulin pricing, regarding insulin and diabetes drugs. You have the floor. If you could please keep your comments brief, we would appreciate it.
Thank you, Mr. Chairman, members of the committee. I do have a long presentation, but I'm going to try and paraphrase it, and I'll provide the committee shortly with a written statement. I appear today before the committee on behalf of America's health insurance plans and its members. We have concerns with the three bills before you. These bills limit the copay or total amount an insured person is required to pay for a covered prescription for their 30-day supply, regardless of the amount or type of insulin needed to cover the bill. Of course, AHIP is concerned with these bills not only because of the cost-sharing limit, but we feel it does not address the issue of the price of insulin that continues to rise at a dramatic level. And you've heard that before. Representative Morales mentioned about the manufacturers of the real issue. It's a complicated thing, but we're not a middle person in this. We're not a middleman. We're not the distributor. We're the insurers. And you heard somebody talk about shadow pricing. That person was correct in what he said. So we are, as you might know, we are very heavily regulated in the state. Unlike drug manufacturers, we are licensed. And the amount health insurance providers can charge for various plans offered are subject to annual insurer filing rate proposals, which is subject to the approval of the Department of Business Regulations and its Office of Health and Insurance Commissioner. There is no regulation of the drug manufacturers. And that's part of the problem. Passage of this bill as drafted will take away from insurers any effective negotiating power with drug manufacturers. Would increase the prices insurers would be required to pay for insulin coverage regardless of the amount, number, or type of insulin needed. There is a need to balance the following: ensuring access to and affordability of insurance so the patients get the medication and care they need, ensuring the overall affordability of premiums. We're concerned that these bills set a dangerous precedent by trying to legislate how health plans and insurers impose various cost-sharing requirements in different forms. We have to be able to have the right to design plans for the various parties that we represent, including employees. Unfortunately, this legislation innocently discriminates among drugs and diseases by its mandatory reference to one type of drug insulin for one type of disease, diabetes. While it is most worthy and noble in its efforts to protect certain patients, and there are a lot of them, I have members of my family, it suggests that other diseases conditions are less worthy. This is the problem approach to regulating consumer cost sharing and will lead to others, including the drug manufacturers, to require similar legislation. As you probably know, recently there's been increased enforcement by the Center of Medicine and Medicaid Services, CMS, with regard to the increased premium cost, and this could add to the liability of the state and municipalities as they are employers. And the federal government could hold the state and cities and towns responsible for the cost of state-mandated benefits for both plans in the individual and small group market. This is in accordance with the ACA, the Affordable Care Act, which was passed in 2011. The three legislative proposals do not tackle the real issue of pharmaceutical manufacturers continually raising the price of insulin, a product at little change. In fact, it has the unintended consequences of increasing health care costs. Despite being developed and produced before about 100 years ago, the cost of insulin has seen incomprehensible price increases in recent years. In the last decade, the list price of common types of insulin have roughly tripled, even though they are the exact product offered 10 years ago. The list price of 1 milliliter vial of insulin produced by one manufacturer was about $93 in 2009, and today it costs close to $275. Another manufacturer's product also cost about $93 for a 10 milliliter bottle, and today the same product costs about $290. AHIP urges the committee to pass legislation limiting the ability of manufacturers to implement these price increases and require transparency. In closing, this legislation may inadvertently increase the bargaining power of pharmaceutical companies. Limiting cost sharing and restricting the use of formularies further disadvantages the pharmaceutical companies. And they'll continue to increase the price of insulin as there are no restraints and no accountability on part. You and I, the consumer and the employer, will shoulder the financial burden to increase premiums rather than through cost share. We should be requiring strict transparency of drug manufacturing pricing practices. This does not address this issue. This bill does not address this issue, and that is the problem. On behalf of AHIP, I will plan to offer language that would require manufacturers to file annually a report regarding increases and the reasons thereof. And yes, we do have another request. We're not opposed to the bill. We would add that by adding the cost for a 30-day prescription. AHIP and its members share with you the objective of protecting patients and will continue to work with the bill sponsors and this committee to make this a more accountable and affordable bill for all. And I thank you for the consideration you gave in addressing this issue forefront and taking consideration our concerns with the bill as presently drafted.
Thank you, Mr. Martinez,
Thank you,
for your testimony. If you would hang on, I'd like to see if there are any questions for Mr. Martinez. Martesian. Okay, thank you very much, Mr. Martesian. We're going to move on. Do we have any other people to testify regarding these three bills? Are there any questions from the committee on these three bills? If not, I will close the hearing on House Bill 5151, 5251, and House Bill 5196. I'd like to thank the committee for their attention. That was quite a bit of testimony. We do have some other bills to move forward. I am waiting to hear back from Representative Edwards, who will be testifying on House Bill 5245. In the meantime, I will move forward with other House bills on the agenda. I will try to do them in order